vastus intermedius attaches from the proximal anterolateral surface of the femur and also the lateral lip of the linea aspera, and then it's going to insert into the tibial tuberosity via the patella and the patellar ligament, and the tibial condyles via the retinacular fibers. And because Hey everyone, Steven here with TV Fork, and this week's YouTube shorts are dedicated to the vastus intermedius muscle. The vastus intermedius is one of your quadricep muscles, and one of its responsibilities is going to be stabilization of the patella, which makes it a very important muscle, especially managing something like knee pain, because when the vastus intermedius gets really weak, what's going to happen is you can develop a lot of instability in the patella. So what you would want to do to mitigate that would be to do some strengthening exercises for the vastus intermedius muscle. For the vastus intermedius, there are only 3 bones that we need to be covering, and that is going to be the femur, the patella, and the tibia. At the femur, on the front portion, we have the anterior surface of the femur, and then on the outside portion, we have the lateral surface of the femur. And then I'm just going to go ahead and flip Johnny around. Right over here, this line is the linea aspera, and that's it in terms of the femur. Then, just inferior to the femur, we have the patella. The patella is your kneecap, and just inferior to the patella, we have the tibia. The tibia is your big medial shin bone, so the shin bone being the bone closer to the inside. And then on the anterior surface of the tibia, the proximal portion, we have the tibial tuberosity. Just lateral to that, we have the lateral condyle of the tibia, and just medial to that, we have the medial condyle of the tibia. But those are the only important bony landmarks when discussing the vastus intermedius. The vastus intermedius attaches from the proximal anterolateral surface of the femur and also the lateral lip of the linea aspera, and then it's going to insert into the tibial tuberosity via the patella and the patellar ligament, and the tibial condyles via the retinacular fibers. And because it crosses the knee, we know it's going to have an action at the knee. At the knee, its main action is going to be extension of the knee, and that's pretty much its main action. The vastus intermedius is innervated by the femoral nerve, and more specifically your L2, L3, and L4 nerve roots. And the reason that's going to be very important is because if we have any type of damage or compression to the nerve roots in those areas, then the nerves are not going to be able to send the proper signal to the vastus intermedius to fire properly, and that can limit blood flow and oxygen to the area, which can lead to things like low back pain, hip pain, knee pain, ankle pain, and foot pain. So you would want to address it immediately. And one of the ways in which we could address it would be to do some ELDOA exercises for the nerve roots in those areas. The reason the ELDOAs are going to be so great is because the whole purpose of ELDOA is to create space within a joint. So if we create space within the joint, that can improve the function of the nerve roots, which will allow the nerves to send the proper signal to the vastus intermedius to fire properly. Today I'm going to be taking you through a strengthening exercise for the vastus intermedius muscle, and it's going to be a variation of reverse Nordic curl. And because we're going to be in a tall kneeling position, that means we're going to be emphasizing the proximal fibers. Because we're targeting the vastus intermedius, and it's right down the middle, we want everything stacked up properly. So the knees, we want them directly below the hips. At the pelvis, we want to maintain a neutral pelvis. We don't want to go into retroversion, and the reason we're avoiding retroversion is to minimize recruitment of the rectus femoris muscle to get maximum recruitment of the vastus intermedius muscle. At the spine, we want everything nice and straight. So the external auditory meatus, the glenohumeral joint, the greater trochanter of the femur, and the lateral condyle of the femur all in one straight line. You're going to place your arms down by your side, and then the principle of action, we want to go ahead and go into as much knee flexion as possible, but this is the strengthening exercise for the vastus intermedius muscle. Today I'm going to be taking you through a myofascial stretching exercise for the vastus intermedius muscle, and for it we're going to be in the tall kneeling position. At the pelvis, we want to maintain a neutral pelvis, and we want to avoid going into retroversion of the pelvis. The reason we're avoiding retroversion is because we want to release tension on the rectus femoris muscle to get maximum stretch of the vastus intermedius muscle. And then for it, pretty straightforward. Tall spine, so the external auditory meatus, glenohumeral joint, greater trochanter femur, all in one straight line. And then all we're going to do is go into maximum knee flexion by sitting down onto our heels. And this is the myofascial stretching exercise for the vastus intermedius muscle. For the L3, L4 ELDOA, we're going to be in a seated position with our legs extended and our heels touching. We want to flex our knees to 90 degrees. We're going to go into dorsiflexion of ankle by pointing the toes toward our head, eversion of ankles by pointing the soles of our feet away from each other, and then we want to drive our knees down toward the ground. We're going to take our heels and bring them nice and close so that they're not touching. At the pelvis, we want to go into retroversion of pelvis, flat lumbar spine, flat thoracic, our chin is tucked in, crown headed up, eyes are looking down at the floor to put the dura mater under tension with the arms, maximum extension of elbow and wrist, maximum external rotation of shoulders, flex the shoulders to the level of coronal plane, so bicep in line with the ear. We're going up with the palms, up with the crown of the head, dragging the knees down to the ground, and this is the L3, L4 ELDOA.